wanted to have patients at the core of this event. So our first speaker comes from a patient organization from Saarland, the Saarländische Krebsliga. So I'm very happy to introduce Dr. Ortwin Zais, Vice President of this organization. Ortwin Zais studied medicine in Berlin and graduated in 1991. He first worked in dermatology and cardiac surgery. And in 1994, he followed further training in the field of outpatient medicine with a focus on dialysis and oncology. In 2001, he continued his training as a general practitioner in the Department of Internal Medicine at St. Joseph Hospital in Hermeskeil. During this time, he acquired the additional certification of naturopathic medicine and treatment, where the main focus is and was the main focus of his medical activity. He then followed further training on biological cancer therapy, obtaining a certification in 4 courses. And now Dr. Zais counts on his qualification of psychotherapies on 2008, and he's also an emergency physician. So please, Dr. Zais, you have the floor. And I would like to kindly ask all the speakers to 6 to 7 minutes presentation, so we have some time to question and answer us afterwards.
Thank you very much for the introduction. I'm always impressed on my own life when I hear what I have done until now. I'm here on behalf of the Saarländische Krebsliga, and my really chief, Ms. de Temple, I will introduce her on the next slide, please. She, when her brother developed reticulosarcoma, got in contact with conventional medicine and also integrative medicine. And her intervention prolonged the life of her brother from 6 months, which did tell the conventional medical doctors, to 18 years in reality, in a good, and this is important, good quality of life. He passed away in 1981. So she said, when my brother can live for more than 6 months, I will will give my life to help affected people with cancer. Show the next slide, please. She founded in 1978 the Saarländische Krebsliga. So it's an organization by affected people for affected people. They were always innovative and in many ways pioneering, and it is her force who gave psychoneuroimmunologic a part of an integrative treatment together with Professor Zenker. She was the first to give tumor conferences with different doctors over patients' health decisions. She integrated end-of-life care, and they went to schools to treat also children with a healthy life for themselves, and so on. There's many more to say, but in 7 minutes, this will be enough. The next slide, please. So, sorry, the focus is always on the quality of life of these affected oncologic patients. And the Saarländische Krebsliga herself does not work with statistics, but we work with human beings. And we want to help those affected and their families, regardless of social backgrounds. So if there is money needed, they will get a little money. If there is every support with other doctors and so on, we give them support to find their way with their oncological cancer disease. So the next slide, please. What does integrative medicine say for the Saarländische Krebsliga? Medicine has an experience which comes from centuries, not only 20 or 30 years. Integrative medicine has a little negative impact for those affected people, and it always has the focus on the human being and not only on his or her disease, which is very important. We always see the whole human being and not only the cancer to be treated. So in the next slide, I will give you 3 impressive numbers. When we say that human beings consist of 100 trillion cells, and in every cell, we have 30,000 up to 100,000 biochemical reactions per second. And per second, we have 30 quintillion biophysical contacts, biochemical contacts. I think this is really impressive. And so in treatment, we have to take care of this whole human being and not only a little part of it. I think esteem, humility, and respect is a necessary attitude also in medical accompaniment of the affected persons. So in the next slide, we will say integrative medicine in cancer therapy says always also complementary medicine, integrative medicine beside the, let's say, normal medicine. Always, and this is very important in cancer therapy, hyperthermia, right from the start, not only at the end. And always, we have to take care on the soul or the psychological situations from the beginning and not somewhere at the end. A few words to hyperthermia in the next slide, because Dr. Zais will talk about this topic. We differentiate between whole body hyperthermia, which is in a mild or moderate, consider up to 40 degrees, or regional local hyperthermia as a capacitively coupled electro-deep hyperthermia. In the next slide, we will see some machines who do this. On the upper left, you have the regional hyperthermia. On the right, you have two devices of whole body hyperthermia and the German guidelines on hyperthermia, which Dr. Zais can perhaps tell about more. In the next slide, I will give some information on the advantages of hyperthermia. As a fourth pillar, it is an essential part on overall concepts. It makes a significant contribution to the success of complex therapy concepts, and it has no additional burden for affected persons, which is very important. In the next slide, it is a synergism with chemotherapy and or radiotherapy, and it has an improvement or preservation of quality of life. In the next slide, I show you one patient which I had in my office. He had a pancreatic cancer, and the survival rate on pancreatic carcinoma is 10 years, about 10% about 5 years, and 8% about 10 years. So most people live a few months only. In the next slide, this patient got surgery, chemotherapy, radiotherapy. This is conventional medicine. Then he got local hyperthermia from the beginning, nutritional supplements from the beginning, and psychotherapy from the beginning. And he is sane. Any cancer anymore. In the next slide, we have some examples of the members of the Cancer League. When a person with a liposarcoma lived 15 years after diagnosis, a patient with lung carcinoma, he had liver metastasis, brain metastasis, kidney metastasis. He had a good quality of life for 8 years until he died, always with the treatment, which I'll show you afterwards. A patient with a glioblastoma lives since 12 years and still is living. Another person with a pancreatic cancer lives since 13 years after diagnosis and is still living. In the next slide, all got conventional orthodox treatment, all got integrative therapies, hyperthermia, and all got psychological support in the community of the Saarland Cancer League. So at the end, next slide, please. And I apologize for the German word Schlussfolgerung, which means conclusion. I forgot to translate. Every human being decides for themselves about their body. Every human being has the right to appropriate therapy, and every human being has the right to financial support from health insurance for the treatment he or she wishes to receive. And in the next slide, I thank you for your attention. I'm in time.
Thank you so
Thank you
much,
very
Dr.
much.
Zais.